Have you ever heard the term borderline personality disorder? Maybe you are still unfamiliar with this term. In fact, we may have dealt with people who have borderline personality disorder. In the general population, it is estimated that 2% of people have borderline personality disorder. Recently, the Department of Mental Health, Faculty of Medicine, University of Indonesia, FKUI, and Dr. Hospital, Cipto Mangunkusumo, RSCM, launched a book entitled Knowing and Overcoming the Threshold of Personality Disorder. The launch and book review was carried out virtually on Sunday, 38th, through the Zoom application. This book is the work of 2 teaching staff from the Department of Mental Health FKUI RSCM, namely Dr. Sylvia Detri Elvira, SBKJ, K, and Dr. Nurmiati Amir, SBKJ, K. Let's take a closer look at borderline personality disorder. Characteristics of borderline personality disorder. According to the authors, in the general population there are 2% of people with borderline personality disorder, or often called ODGKA. As many as 10% were found in outpatients and 20% in inpatients. Approximately 70% of PLHIV exhibit self-destructive behavior, and as many as 8% to 10% die by suicide. Threshold personality disorder, GKA, is a condition that is not widely known or realized by those who experience it in their immediate environment. ADD is a form of personality characterized by unstable social relationships, especially interpersonal relationships, self-image, inability to control emotions, often impulsive, and often self-destructive behavior. ARF is a condition that is often encountered in clinical practice and also in everyday life, especially in adolescents and young adults. In the clinical practice of psychiatry for the last 10 years, according to Dr. Sylvia, this GKA tends to increase. People who have friends, relatives or relatives who experience this ADD condition must understand the characteristics of ADD. This is because the condition of borderline personality disorder is often not known or realized by those who experience it in the environment of those closest to them. People with ARF will experience a very uncomfortable state because their emotions are unstable, easily changing in minutes, hours, or days.
People with AKI need immediate help because they often do self-harming behavior to overcome the feeling of emptiness they experience. This situation also makes people with ARF often visit the emergency units of the nearest hospitals.
By studying the signs and symptoms of ARF, it is hoped that we can anticipate if he or his friends or relatives experience this condition, so that they can seek medical help early, so that their functions in daily life can recover, said Dr. Sylvia, through the release that GISHAT received. Can be experienced teens to young adults. Further, Dr. Nurmiati Amir said that people with borderline personality disorder are mostly found in teenagers or young adults who are in their productive age. They need support from their family and loved ones. The Dean of FKUI, Professor Dr. Ari Farial Siam, SPPDKGEH, MMB, also gave his opinion. The impact of the current COVID-19 pandemic is not only threatening physical health, but also mental health, which needs special attention. We can see from the increasing number of patients who come to psychiatry clinical practice, he explained. Professor Ari Farial added that some of the general public still find it difficult to access correct and reliable health information. With so many hoaxes circulating through social media, it is not uncommon for patients and their families to make wrong decisions because of this information. With information through books written by experts, it is hoped that it can be a guide and source of information that is easily understood by all groups so that it can help anyone who reads it. The sources for writing this book were compiled from literature searches and a bit of experience helping patients with borderline personality disorder. The purpose of writing this book is to be able to share with others, for sufferers and their families, especially parents in the closest environment, so that they can become well-functioning supporters for people with ADD, explained Dr. Nurmiati.